look, I'm about to be in my 11th year free from drinking.
Congratulations.
And thank you very much. I have a very hard time calling alcoholism a disease because it was still this hand on my body that was reaching for it that I control with my brain.
Yes.
So, that leads to a lot of guilt and shame and terrible things, right? Because I was the one that reached for it, and this is not a personal therapy session, but I need to know, is it a fucking disease?
Okay.
Is it a what?
So can you accept, a lot of Americans have trouble with this, that brains get diseases?
Can I accept that brain? Sure. Yep.
And that when brains get diseases, it affects your thinking and your behavior and your choices and your motivation.
Affirmative.
Alcoholism and addiction, which is really one thing to me, just what your drug of choice is the thing, is a disease of the brain of motivation. It's a motivational disturbance. And once the motivational disturbance kicks in, multiple other injuries come along with that, or phenomena come along with that. So that's one issue. So the question that becomes, if somebody's going to decide, is this a cup or not a cup? Oh boy. Don't we first need to define what a cup is? Like, shouldn't we have a definition for it, right? Not just this cup, but all cups, okay? So we have to define what a disease is. Fair enough?
Fair enough.
Okay. How should we do that? What is a disease? What are the components of a disease that will cover all diseases? So then we can say, well, does this thing we call alcoholism fit into this thing this definition we call disease?
I guess it's an imbalance, right?
Sometimes. Of what?
Of the stuff.
Of the stuff. So I'll turn over the cards. Don't feel bad because I've asked this question to faculty members in medical schools and things, and they all go, people don't think about these things, and it's important that they do. So the only legitimate, well, let me tell you disease first. Disease is a complex relationship between the genetics of the substrate, the individual, and the environment. So it's a gene-environment interaction that results in an abnormal state of physiology. We call that pathophysiology. The biochemistry is altered in some way you call it out of balance, but I would altered in such a way that it creates a natural history, right? And a natural history is a predictable progression of signs and symptoms that end in some way. They either get better, or they become chronic, or they kill the patient, whatever. These signs and symptoms are predictable. And then people like me study those signs and symptoms and try to improve them with something we call treatment. And then we study the treatment so we know which ones are best for the signs and symptoms. So that's disease. Gene environment, abnormal physiology, signs and symptoms that progress in a predictable pattern with a predictable response to treatment. All disease fits into that category. Where people freak out with addiction is the fact that the disease is in the brain. The physiology problem is in the brain. And we want to have free will. We want to be able to trust our thinking. We feel like our motivations are well served. I mean, think about what happens in addiction. Your motivational priorities disintegrate and one emerges as the only and ultimate priority. And then all the other systems in your brain serve that motivational distortion. Going to work, raising my kids, not endangering other people, my health, all that stuff becomes not important. Using becomes the priority. And I start thinking things to justify that or to make that keep going. That thinking, that stinking thinking, is part of the disease. Then I also lose my impulse control. Like that's part of the progression. You can't control impulses as well.
And really can't? We can't.
As well.
But there's always a could, right? You always could not reach for that drink.
Yeah. But magically, humans with this condition always do go back. That's part of the signs and symptoms of this condition that people with this thing can't. If they can stop, they should just stop.
It's so hard.
Right, because they can't. It's just without some kind of something.
I understand that.
Yeah.
There's nothing more hopeless than thinking you can't get sober. And so I'd really love to leave our listeners, our viewers with, you're a man with a lot of experience. You've seen a lot of people come and go through treatment rooms. What's the most hopeful thing we can let people know?
Where my head goes immediately with that is that the most hopeful thing is that anybody can get better, no matter how hopeless they seem. I've seen it. It's what gives me hope for the next one. The situations that I thought were completely hopeless, people just surprise me. I've also had people that I thought were going to do great that didn't do so great. So you can't predict what's going on, but anybody can get, miracles happen all the time. If you just do what they tell you to do, you'll get better. It's pretty simple. Just follow direction, surrender. Surrender is the goal.
Listen, there's not a day that goes by, even with 11 years off the sauce, that I'm not, I don't know, maybe just one glass. Like, I'm still not even sure I've made it to the surrender part. Like, I'm pretty confident that I'm not really an alcoholic, even though I've like blown up my life several times over.
Not being fully surrendered is common. And, but you will still get a lot out of it, I promise.